All
All
right.
right, go ahead. We're going to let you just present and do your thing. We're so excited to have you here with us today.
Thank you. Thank you so much, Ashley and Dawn, for giving me this platform and, of course, allowing me to be a resource for your accountants who are part of the membership, as well as maybe for your clients as well. So, a little bit about me. My name is Noor. I'm currently living in Tampa. I am a medical background by education. I'm originally from Bangladesh, where I did my medical education and training. But right now, I'm living in the States, and my business practice really involves around helping entrepreneurs, small business owners, anyone who's 1099 and has to figure out their own health insurance. I help them to access either hidden health plans or really just figure out what health insurance option is best. I know that's a big, daunting piece when it comes to business finances, and it can be confusing. And the experience that I've had is most people just deprioritize it. At one point, they just say, "Screw it! I don't even need health insurance. My business is more important, and all the other aspects are more important." So they end up foregoing it altogether. So I've seen that. I've also seen that those who, are limited in their knowledge about where to really go to seek out the appropriate health insurance options, they come across certain resources and the options seem so expensive. They're just like, okay, screw it again. I can't do this. This is like more than my rent or mortgage. So what I'd like to do today is really just kind of lay out the landscape of health insurance in America, the role of the ACA, the Affordable Care Act, and how we as 1099 professionals can just understand our options. I feel like just understanding and knowing it is a really big step in deciding on which direction to go to. What do you think, Ashley?
Absolutely. I think this is so huge because I know as a small business owner, and then when we work with our clients, they have no idea what to do about health
Yeah,
insurance. They've aged out of being on their parents' health insurance. They
yeah,
don't have, especially people that don't have maybe a spouse that they can get on their own or get on their insurance.
sure.
It's such a big need. And like you said, I think some people are just like, well, I guess I'll just go without it for a little
Yeah,
while because it's so
yeah,
expensive. So I'm
yeah.
so excited to hear kind of what you're going to teach us today.
Yeah, absolutely. Sure. So the first thing that I'd like to give as a baseline foundation knowledge is that health insurance is governed by state law, not by federal law. So each state has their own laws and rules and regulations, which really affects what options are available to you. So where you live really has everything to do with what health insurance options are available to you. But as a freelancer, let's say you don't have the luxury or the liberty of a spouse who works for a large corporation or company and can give amazing health insurance benefits, right? What if you and your spouse are both 1099 or self-employed? So you really have two options or two main ways to go about picking a health insurance plan. And I'll keep it real simple. Option A is going to be your state-sponsored healthcare marketplace. And that's commonly known as Obamacare in 2008, the Affordable Care Act, healthcare.gov. All of that is synonymous. And that's where you can really just go online to healthcare.gov. A user-friendly version of that website, which I'll share, is called healthsherpa.com, and you just punch in your zip code, how much you make annual income, and this is gross, guys, not net. So I know that as business owners, there's tons of expenses that come into play here, but that's not what they're interested in knowing. They're interested in knowing your gross, right? And that's what it's calculated off of. And you get a list of plans available to you in your state. Sorry about the baby noise in the back there, putting my kid down for a nap. Um, and you get a list of plans available to you. And there's some pros and cons here. Now, the pros are it's guaranteed issue. So anyone and everyone can just go online and pick out a plan, right? So it doesn't matter how sick you are, how poor you are, how healthy, whatever, how rich, anyone can get a plan. Now, but if you are healthy and you're making over a certain income threshold, and that threshold, to be precise, is 400 to 600% above the federal poverty level. So for example, for someone who's a household size of one, that could mean an income over 45,000. So if you or your business is making over 45,000 and you go on to healthcare.gov and you look for a plan, you're going to see prices that reflect like something like a rent or a mortgage payment because you're not qualifying for any subsidies. Okay, so that's a con there. And in addition, the networks that are available for Obamacare are very limited to where you live. They're HMO plans only, which means you're going to be dictated which primary care provider you have. And if you need to see specialists, you need to get a referral slip to do anything. So definitely pros and cons there. If you are making under 45,000 for yourself or for your business, this might be a good option because you're going to qualify for a subsidy and get reduced premiums, right? But you're also asked to project out your income, which can be really, really difficult for freelancers. And if you under project and you make more than you said you would, you're going to actually owe the government in back premiums, which no one likes. And I'm sure you might have dealt with that some for your clients as well. So that was option A in a nutshell. Any thoughts on that, Ashley?
Yeah, I just think it's really interesting that because you're saying that 40 or 45,000 is on sales, basically, not like net income or profit.
No, it's gross.
Yeah. So that is really interesting because that's not a lot, especially for someone who's supporting themselves with their business. And then as it grows, if you end up, maybe you think, oh, it's not going to be that big this year. But then if you cross that threshold to have to owe back, it's really interesting.
It's also household, Ashley. So if you're a small business just at the startup stage, but you have a spouse who has an established W-2 income, they're taking that combined income. And again, you're not qualifying for a subsidy, even though you're just starting out. Maybe your business only made 20K, but your household income is pushing you up above that threshold. So the only time I would recommend an Obamacare plan for freelancers is really when your income is below 40K. Because as soon as you cross that threshold and you're not qualifying for a subsidy, that's a perfect time, to opt out of the marketplace and switch to option B, which is a private market plan, which I'll talk a little bit more about now. Anything else I want to mention about Obamacare? Yeah. So if you project out, let's say you projected 60K for your income and you ended up making 70 or 80K, I would say as soon as you hit that threshold that you stated that you would make, that's the time to pull out, and switch.
So that they don't go back and charge you for that difference. You just go ahead and opt out and join into like the thing you're going to talk about next.
Yes.
Yeah.
But also what are the times that you should actually use Obamacare is when you need chronic care. If you're diabetic and you have a major pre-existing condition that requires expensive medicine like insulin, and you're going to meet that deductible and you need the care, that's an appropriate time. But essentially, if you're healthy and you don't overuse insurance and you're wealthy and you're crossing that over 400% over the federal poverty level, that's the time to switch to option B, which is the private market. And the private market has hundreds and hundreds of companies offering tons of different plans. And it can get really daunting, really confusing. You don't know what to Google. Once you start, you're going to go down a rabbit hole. So I'll break it down with some types of plans and policies just to guide you in what's appropriate for you. So I'll talk a little bit about the type of plan that I love working with a lot, and that's a medically underwritten plan. And that essentially puts health back into the equation that Obamacare took away. So remember, option A, health is not a matter at all. It's all based on your income. That's how the premiums are calculated. Whereas with the medically underwritten plan, we're using health as the qualifier, not the income. So the younger and healthier you are, the lower risk you appear to a health insurance company. So they're willing to give you better rates and better coverage. So when using health as a qualifier to lock in a health insurance premium instead of income, that can bode well for small business owners because you're expecting to grow, you're expecting to make more. Having a health insurance premium that's tied to your income can get really slippery, especially if you're growing fast. So that's what I recommend if you can qualify, medically, if you're generally healthy, then you can definitely qualify for one of these plans and get a lower rate and lock it in based on your health. And of course, as your business grows, your price isn't going up and you've already locked in a great plan with great benefits. And a snapshot of some of those benefits is it comes with lower deductibles, which I'm a huge fan of. Deductibles are actually more important than premiums to look at when you're shopping for a health insurance plan. They can be PPO plans, which are very hard to access with Obamacare. If you're traveling, moving around, or if you're a digital nomad and freelancers, you have the flexibility to take your business anywhere. You don't want to be locked into the county that you live in. That's where a PPO plan can be very beneficial. It'll work anywhere in the country. So those are some of the pros for that. Any questions for that, Ashley?
Just a couple of things. One, what you just said about the PPO plan, I didn't really realize that was a benefit of a PPO plan, is that if you're moving around, if you aren't locked in one place, that you can get health insurance wherever you go. Because I know with my health insurance, it only covers like certain states, certain areas. And if I'm outside that coverage area, then it's not covered.
That's right. HMO and PPO are oftentimes thought of as a type of health insurance plan, but it actually refers to the network of doctors and providers you have access to, regardless of what your plan benefits are. So if you have a fantastic plan with, zero copays, everything covered at 100%, but it's an HMO plan, you can only use that where you live. So if a short answer, if you have the option, go for the PPO. It's going to give you much more flexibility. You can go see specialists without needing referral slips. You can really go anywhere you want. And of course, take that plan with you as you travel, and it works nationwide. So go for the PPO. That's my tip there.
Yeah.
And I mentioned something about deductibles, which I'd like to talk about, because I think this is, it's such a myth, especially among the younger population. If you're in your early 20s or something, or you just aged out of your parents' plan and you're starting a business and you just need to pick a plan, right? A big common misconception that I see is people picking the lower premium and higher deductible plan, which often goes hand in hand. The lower the premium, the higher the deductible. So to define it, a deductible is the amount of money you have to pay in addition to the premium before your insurance company is going to give you the benefits according to your policy, whatever your benefits are. So if you're young and healthy, it's so unlikely that you're going to meet a high deductible. In the very unlikely event that you actually do end up in the emergency room or need a major medical care, you are just ensured that you're going to be paying more out of pocket because you have a high deductible. Your insurance company is not paying. What is the likelihood that you're going to spend $5,000, $7,000, $10,000 in medical expenses every year? Very unlikely. Right? So you want to make sure that when you do need to use your health insurance, that your insurance company is paying, not you. So that's when it's appropriate to choose a lower deductible, right?
Yeah, absolutely. I'm thinking of this probably gets a tiny bit personal for my poor stepdad, but he has diabetes. And so it makes it's different for him than it is for me because I'm not going to the doctor very often. So I want a low deductible plan so that I'm not having to pay a lot out of pocket anytime that I need to go. Whereas he meets his deductible like in February of every year.
Right.
So it's different.
And that's an advantage. If you meet your deductible early on in the year, good for you. Use that insurance plan for the rest of the year. Right. I remember when I had a baby in 2020, it was January, and I ended up needing an emergency C-section. So I met my deductible and max out of pocket. I was like, perfect. I met it in January. This is a great time to all year long use my insurance for all it's got and take advantage of the benefits of the policy. But again, as freelancers, as small business owners, you don't always have access or options to a whole lot. So if you have the option, go for the lower deductible, pick the PPO plan. So that was one type of plan I mentioned in the private market. There's a few other types. I don't always love or recommend them, but it's important to know just what they are depending on your situation. Another type of a plan that's common is called a short-term medical plan. And it's really designed for just that. It was originally designed as gap coverage. When you're between jobs, trying to figure something out, or your new job doesn't offer benefits for like 90 days, that's an appropriate time to choose a short-term plan. But now they're so flexible. You can extend that term to 3 months, 6 months, 9 months, 1 month. Right. But keep in mind that they're really not meant for long-term comprehensive coverage. So if you're looking for something to set it and good, something more standard, more traditional, a short-term plan might not check those boxes. They can be very cheap. They can be very affordable. But again, if you want a plan just to say, oh, well, I have health insurance, but it's not really going to cover much, just keep that in mind.
Yeah, that's good to know. But if somebody knows that something is going to happen in 6 months, or there's going to be some kind of job change, or maybe they have a spouse that's going to have health insurance available for them at a certain point, and they could get on something like a short term before they switch.
Exactly. Yeah. So that's a good option there. And they can be very, very affordable. Lots of options there. I work with so my specialization is medically underwritten policies. I love that. And I work with that a lot. And it's something that I can put my name behind. I truly believe in it. So when I'm helping a client and I can basically offer this to them and they're a good fit medically and it makes sense for them budget wise, it's such a rewarding feeling that I actually offer my services throughout the length of the policy. Anything happens to you on that plan or you need any type of help at all, I'm here for you 24/7. So that's for the medically underwritten plan. And I do have, relationships with referral colleagues. If you need a short-term plan, hey, I don't work with that, but I can refer you to someone if you need something like that. And the third option I'd like to point out today, It's not really health insurance at all, but it's called a health sharing plan, and it can be a good option for many. It's oftentimes a faith-based community where everyone basically puts in some money into a pot every month. You can make that analogous to a premium, and you're sharing the cost of medical expenses. So if someone in that community has a major medical event or has a big medical expense they were not expecting, a heart attack bill, a surgical bill, you then look back into the pot and say, hey, can we help this member of our community and share in their medical costs? Now, it works fantastic for many, but if you actually walk into the emergency room, there's no real card to present because it's actually not health insurance. So just keep that in mind. It can work for some, it doesn't work for many. And where do you find health sharing plans? John asked, and it depends. If you can there's again private companies that offer it. You can start a search and see what's offered in your state, but they also do have PPO options, which is great because then it can work everywhere as well. But there's a balance here because again, because it's not traditional or health insurance at all, the same rules don't really apply to it. So it can be tricky.
So with a health sharing plan, would it look like you would go to the emergency room, you would pay out of pocket, and then go back to that health sharing plan and ask for them to reimburse you for your expenses?
Exactly. So you'd essentially be self-pay, as if you don't have insurance, pay up front, later maybe do some negotiation to reduce your bills if you're looking at big bills, and then appeal to your health sharing community for reimbursement for those medical costs.
Okay. I think I actually heard of that before and I didn't quite understand it. And that was a very good description of kind of what it is and how it works.
Yeah. And like I said, it can work for many, especially if you're healthy and you never really needed to use it, and it can work great for you. But if you've had a poor experience with it, and let's say you did have a major medical event and there was either it wasn't covered or there wasn't enough money in the pot for you, that can lead to a poor experience as well. So it's really all about, a common question I get asked is, what's the best company for health insurance? And it's really not about the company at all. It's really about your policy benefits and does it cover what you need it to cover? Like if you're looking for pregnancy and maternity coverage and you're on a plan that doesn't cover maternity, you're going to say, well, that plan sucks, right? But someone who doesn't need maternity and it covers everything they needed to, they're going to say, well, this plan is awesome. So it's really just about the benefits and at the time. And I always tell my clients to do an evaluation, to take advantage and leverage your situation right now to go on the right policy. If your income is under 20K, get an Obamacare plan. If your business is growing and you're quickly exceeding what you projected your income to be, get on a private plan, right? If you need maternity, make sure you get a maternity plan for that year. But of course, jump off it if it's too expensive and you don't need it after you've had your baby.
Right. So just kind of evaluating your situation as you go and looking at the plan, not necessarily the company or I guess the company, but more of what it's going to offer you.
Yes, more the policy and the benefits, and does it work for what you need it to cover? You're going to love your plan if it covers what you need it to cover, right? So it's really just about the policy. Yeah.
Do you specialize in a certain size of companies, like a certain number of employees? Is there a certain level where it makes sense for them to do something different? Or tell me a little bit about
great question. So the offerings really depends on the size of your company. So and of course, tax laws come into this. So you guys might have a better idea than me, but once you exceed a company size of 50, let's say, and you're filing as a corporation, you get offered different benefits than if you have a smaller company and your employees are all 1099, let's say. So I like to work with under 10 because but that's not a hard number. It can be 15, it can be 20, but smaller company sizes, because there's so much flexibility in what you can do. So if you're a small business owner and you want to reward your employees, and even if they're 1099 and you just can't afford to offer them full health insurance benefits, you can do something like offer them a stipend or a credit in their paycheck that goes towards their health insurance costs. And you can say, hey, talk to Noor. She can find you a plan. I can't pay for this right now, but here's a little bit of money towards it. You can pay 50% of their premiums. You can pay full premiums, or you can just refer them to me. So there's a lot of flexibility with smaller company sizes. And when you get into different size groups, over 20, over 50, you get offered different packages depending on your company size.
So this is something I probably should know, but if you have employees and contractors and you decide that you're going to offer health insurance to your employees, do you have to offer it also to your contractors, and do you have to offer it to all of your employees?
Not at all. Not at all. You don't have to offer it at all, and if you choose to, there's flexible options on how you can pay for it, or you can just not. You can say, hey, I can't afford to give you health insurance right now, but talk to this person. She can help you find a right policy for you, an individual policy for you.
Yeah. Yeah, absolutely. I'm trying to think if I have any other questions, but really I'd like for you to share how people can reach out to you, because I think this is going to be such a good tool for not only the people that are in Accountants Lounge, but also our clients, because I know that we get asked about health insurance a lot.
Yeah, definitely. And I would just say, just have a conversation with me. It's really difficult for me to give any numbers out or any
Right.
specific advice without listening to your current specific situation. Something that I always teach is like I just said, leverage your position, leverage your situation, and change that as you grow, as you develop, and evaluate that. So all of my consultations and services are 100% free. I don't charge anything for my advice or what I do. You can learn more about me at my website, drnoorhealth.com, drnoorhealth.com. And definitely there's ways to book a call with me and get in touch on social media as well. I love to educate and just give little nuggets of information. So you can find me and connect with me on social media. But I really just want to encourage everyone to just reach out to me and have a chat. If you yourself don't need my services, but your clients may, and you refer them to me, I can offer a $50 referral credit to you, a $50 cash bonus to you if you're not my client. And if you're my client and you give me a referral, that can go anywhere from $100 to $200. So definitely would love to speak to you guys and your clients if I can help them out.
Awesome. Well, I know for sure that I'll be adding you to my referral list. And I suggest anyone that's watching this recording to do the same. That way,
Yes.
if we're on a call with a client and they even mention health insurance, then we have an awesome person to send them to. And I was telling Nora earlier, her website has an awesome frequently asked questions, and it's really, really informative. So anyone that's watching this, if you guys have questions about exactly what she does or health insurance in general, she has a lot of great resources there. But we'll be sharing your information in our membership area. This call recording will be put in the membership area, and then also in our Facebook group, so that people can reach out to you and follow you and learn from you, because you are so knowledgeable and make it so much easier to understand.
Yes. Thank you so much. Thank you so much for this opportunity and platform. If I can help anyone anytime, I'm here to help. Thank you guys.
Awesome. Thank you so much. And I hope you have a good rest of your day.
Yeah, you too. Bye.
All right.